Hi guys, my name is Summer Harness. I'm a family nurse practitioner and certified aesthetic nurse specialist. Super excited to show you how to take semaglutide at home in a safe and effective way. So what you're going to need three things. You're going to need your semaglutide, you're going to need a syringe here. Typically we use a 30 gauge and 1/2 inch, which means it's actually really teeny tiny, guys. And you're also going to want an alcohol swab as well. You're going to use this to clean the top of your semaglutide vial. You're going to want to rub the little alcohol swab over the top of the semaglutide for about 10 to 15 seconds is great. That just decontaminates the area, gets it nice and clean. Right, so once you've done this for about 10 to 15 seconds, you're going to go ahead and tilt the vial upside down, remove the cap from your needle. All right, and for this purpose, again, I'm just going to keep the needle capped. You're going to enter the needle into the bottom of the syringe and pull back on the plunger slowly until you get to, for this case, we're going to the 10. This is going to be pretending to be my first dose, okay, guys? So you're going to see the syringe fill with liquid, and you want to try to avoid bubbles. If you do get any bubbles, you can go ahead and push the semaglutide back into the syringe and then pull again gently and smoothly until you get to the 10 without any air bubbles. Once you're there, you're going to go ahead and remove the needle from the vial. You can set this down, and then this will be your 10 of semaglutide. So then what you're going to do is you're going to pick your injection site. The top 3 areas that most of my patients like to inject is actually the back of the arms, the little love handle right here, or the inner thigh in that little fatty area. So because this is a sub-Q injection, meaning it's going in your fat, not your muscle, those are the 3 fatty areas that are a little bit away from your abdomen. So many of my clients experience less side effects if you do it in those other areas. The other note too, because this is a sub-Q injection, not an IM injection, like if you think of a flu shot or your COVID vaccine, you're not really going to experience bruising, bleeding, or soreness that next day because it's not going into your muscle, which is where that soreness happens. So when you're at home injecting yourself, I do want you to have a seat just for safety. That way, in case you ever feel lightheaded or anything, you're already in a safe, secure area. Okay, so now we're gonna go over how to inject yourself. So you're already sitting down, you have your semaglutide in your syringe. What you're going to do is you're going to choose location. So for this purpose, I'm gonna choose this nice little pocket right here. I'm gonna take my alcohol swab. I'm gonna go ahead and clean it for another 10 to 15 seconds. I'm not just gonna sanitize the area. All right, so now what you're gonna do is pretend like we don't have a cap here. So again, for this situation, I'm not going to be actually injecting myself with semaglutide. But you take the little fatty area, you go ahead and push the needle in. You can do a quick little aspiration, make sure there's no red that comes into the needle, and then you can go ahead and inject it smoothly over the course of about 5 or so seconds. So you don't need to slam it in, you can just kind of go gently and slowly, and that'll be more comfortable for that area. Once you're done with the needle, you can go ahead and take it out. You can recap it. How you're supposed to recap, even if it's your own needle, is you can actually just do this little swoop and pick it up like this. That way you're never using the cap to potentially stab yourself instead of recapping. So that's a great way to do it. And then you are going to want to dispose of your needles with a sharps container. That way you're not putting needles in the trash or anything like that. That is the instructions for how to inject yourself with semaglutide at home. If you have any other questions, please reach out with any questions you might have. In addition, one other thing I recommend for my clients is to actually go ahead and remain seating for about the next 5 minutes, just in case you already get lightheaded or anything like that. Sometimes even with clients that don't have this history, you can get a little woozy after giving yourself an injection. So just a good idea, safety tip, to go ahead and stay seating for about the next 5 minutes, just to reduce your chance of feeling lightheaded.